Welcome to the online course. In this particular chapter, we're going to be discussing why All-on-4, why do we use it on a day-to-day basis, what is All-on-4, and we're going to be looking at the biomechanical considerations of this overall treatment concept. Implant dentistry has changed a lot over the years. We've gone from one stage, two stage to one stage. We do immediate loading, we have different abutment designs, and there's been a huge paradigm shift as far as full arch restorations is concerned. Now, if you look to see what the definition of paradigm shift is essentially a fundamental change in approach or underlying assumption, or a major change in how some process is accomplished. So if I was to ask you, what do you see on the screen here? Do you see a young lady or do you see an old lady? And if you take a really close look, some of you may see the young, some of you may see the old. And it really depends on your perspective. It really depends on what you've been trained to see. And in dentistry, it's absolutely no different. Let's take this particular example. If I was to say to you that this patient came to you and was seeking full arch implant supported restorations, what would you treatment plan for this patient? Some of you may treatment plan 6 to 8 implants with sinus grafts and bone augmentation. Some of you may espouse the tilted implant approach and utilize the All-on-4 treatment concept. So as far as full arch implant prosthetics, implant dentistry is concerned, there has been a paradigm shift in terms of the treatment protocols we approach. One treatment protocol employs preserving everything we have, keeping the existing bone, grafting to it, and placing as many implants as you can. And I'm not here to tell you that there's anything wrong with that. The other approach, whether it be for financial reasons or anatomical reasons, results in bone resection, placing fewer implants, and providing patients with teeth the very same day. And this has huge advantages to it. So when we start talking about change, although there have been many things that have changed over the years, one specific thing has always remained the same and always will remain the same. Patients really don't want to wear dentures during or at the end of treatment. So why All-on-4? Why are we here today? Why are we conducting this online course? What is the importance of the All-on-4 concept in your practice? Now let's take a moment to look at some of the statistics. And on the screen you will see the number of edentulous patients that are going to exist in 2025. And you can see around the world this is going to be a huge increase. Now what this data doesn't show is those patients which have a terminal dentition who are soon to become edentulous. Now, if you include those numbers, these numbers would be much, much higher. I don't believe there's going to be enough dentists available to be able to treat these types of patients. So it really is important that you learn these treatment protocols so that we can help as many patients as possible. So why do we do All-on-4? We do All-on-4 because we're able to help many patients. All these patients on the screen here, I would tell you 10, 15 years ago, I would have offered them grafting, staged approach, and I would tell you 8 out of 10 of these patients probably would have said no to treatment. Today, the case acceptance is much higher because patients are getting teeth the same day. Now, I've shared with you the numbers that are out there, and some of you may be wondering, how comes our offices are not brimming with these patients? What are the obstacles to treatment? Why don't these patients come to your office and you have a long line outside your practice? Now, the obstacles to treatment are patients are afraid of wearing a removable provisional. Now, imagine, as I said, there are patients who are edentulous, but there are also patients who are dentate with a terminal dentition. Their biggest concern is wearing something which comes in and out of their mouth. Patients think it's time-consuming. Patients believe that it's painful and it's unpredictable. And lastly, patient thinks that it's very costly, so they avoid going to the dentist for this particular treatment approach. Now, as clinicians, our responsibility is to try and remove obstacles from the patient's way. The problem of wearing a denture, immediate loading has been established for many, many years. It's not something that we have to justify. There's plenty of scientific evidence to support that it works, and we've been using it for many, many years. The problem of it being time-consuming. Teeth the very same day. You follow the appropriate protocols. The patient can walk out your office with teeth the same day and function with those teeth. The problem of it being painful. Imagine the implants are going to be supporting the restoration on the same day. Compare that patient to compare that situation to a patient who's had their teeth removed, implants placed, healing abutments placed, and an immediate denture placed on those implants. That would be much more uncomfortable for the patient than having an implant-supported restoration from day one. Unpredictable, this is done routinely around the world. And from a cost perspective, with fewer implants, fewer appointments, it definitely results in reduced cost for the patients. So the question now becomes, why do patients tolerate dentures? How comes there are so many patients out there that are still struggling with their dentures? The reality is that they have been told that they are not candidates for implant dentistry. And I can tell you in my practice, we have patients on a weekly basis that have been told by their doctors that you just can't have implants because you don't have the bone. Cost is definitely a reason. And the last reason would be that complete denture patients really don't go to the dentist. What would be the reason for a patient wearing dentures to go to the dentist? The only reason they would go is if that their denture broke, they lost a tooth, or if the denture was so loose that they couldn't function anymore. Let's take an example of this particular patient. This patient arrived to our office. She'd been struggling like this for the last 15 years, and she was having a miserable life. She used to take her dentures out and chew. It just wasn't fun for her, and she'd been told by an extremely talented dentist that there just wasn't any bone to be able to help her. And these are situations we come across day in and day out. So for this particular type of patient, together with our surgical colleagues, we're able to provide them with graftless procedures, utilizing the All-on-4 treatment protocol, and literally give them teeth that very same day. This patient had treatment done when she was 82. She is 89 years old, and we have to remember that patients are living longer and longer, and teeth form a very important part of their long-term overall health. Professor Brannemark is the reason we stand here today. He had many ideas and many visions. One of his visions was that patients don't put their teeth in the glass. His other vision was to simplify treatment protocols, to eliminate unnecessary surgical procedures so that we can offer these treatments to patients at a much reduced cost. And I think his vision has come to reality, and it's changing the life of many patients around us. Now, when we start looking at costs, the costs are dramatically different. If you take the example of a patient having grafting, 6 to 8 implants in the maxilla and mandible, the average treatment cost definitely here in the US would be in the region of about $100,000. Now, if you look at the All-on-4 treatment protocol with fewer implants, no grafting, that treatment cost is almost halved. And I will tell you, you'll have much more patient case acceptance at a lower cost if the patient can get a fixed restoration that very same day. So why do we talk about the All-on-4 treatment protocol? It's a great service to patients. These patients aren't really offered these options because most dentists are reluctant to offer because they haven't been educated in the protocol. I will assure you that after going through this online course, you will see patients in your practice tomorrow, the next week, who are searching for these options, and these options are there. These patients are there in your practice to allow you to implement these procedures. So this is another patient who came to see us. She'd been a dentulous for many years, and once again she was told that she just doesn't have any options and she was stuck with her dentures. Imagine today in 2016, patients don't have to live like this anymore. This is literally a disability for a patient to have to live with complete dentures. So if this patient came to see you, how would you treatment plan this patient? What are the options that we could discuss with the patient? Now, definitely some of you may say implant and mucosa supported overdenture. There'd be nothing wrong in that. And we're going to go into that a little bit later on in the online course. Some of you may say extensive grafting and placing 6 to 8 implants. But some of you will know that the All-on-4 treatment protocol was designed for this type of situation, and it works extremely, extremely well. And this is exactly what we had done in this patient. And this patient walked out the door with teeth literally that very same day. And the question you have to ask is, what did this do for that patient? It impacted that patient's life in a manner which the patient probably wasn't even accepting. So I really hope you enjoy the rest of this course, and we look forward to this journey with you.